This week's question asked Dr. Durie is an important one. From a patient who's concerned, I think, about a family member who had an experience where the myeloma fell into a standard risk category and then suddenly started to behave in a much more aggressive fashion. So how could this be that the pattern of the disease would change in this way? Well, the first type of answer to this is that, unfortunately, our testing is not perfect. We have FISH testing and we have GEP. FISH testing is fluorescent in situ hybridization, and this is a fluorescent testing of the bone marrow myeloma cells, which can show if there is a 414 pattern or a 17p minus pattern. These are chromosome abnormalities which we know correlate with the cells being more resistant to treatment and particularly to behave in a more aggressive fashion. Likewise, with gene expression profiling, GEP, we can get a pattern in looking at 70 GEP results to see that there is an indication of more aggressive disease. But those tests are not 100%. Partly because of the sensitivity. Sometimes you just don't pick up the number of cells that are necessary to give you a possible positive result. Other times it's just because we are not aware of all of the things that can be good or bad, and our tests are just not good enough right now. So the first answer is that it could be that there was a positive result initially that was missed or not diagnosed correctly. Now, this can be because the number of cells that had the abnormality was low. Let's say you had 1% of the cells that had 414 or 17p minus. This might not be enough to be obvious during the initial testing. And then let's say you have successful treatment and get rid of all of the cells which have the standard risk, which are the ones that were detected with the initial testing. What you're left with is the small population of cells that have the higher risk. And as the disease is moving forward and possibly going through different cycles of therapy, this population, this subclone of cells that has the higher risk, can come to dominate and be the predominant myeloma that's left as you're faced with further therapy later in the disease. And so a second answer is that the aggressive disease pattern can evolve over time from a very small initial subpopulation. And so this is something to discuss carefully with your doctor to analyze, well, what exactly were the results in my case? What did they mean? Was there maybe a small subpopulation there to begin with? And most importantly now, what are the best options in this setting of more aggressive disease? Because we are starting to understand that better, and there are trials now to look at high-risk aggressive disease. There is a new Southwest Oncology Group trial, for example, where we're looking at the added benefit of elotuzumab along with the VRD regimen to see if this will improve the outcome for patients with more aggressive disease. And so it's important to discuss it, to analyze what is the situation, and obviously to review the best treatment option in this situation.